Alström Syndrome UK was established by Kay Parkinson in 1998. Kay and her husband John had 2 children who were eventually diagnosed with the condition aged 16 and 18. At that time there was very little knowledge and understanding, and Kay developed the charity to offer support to other affected families throughout the UK. The charity has grown from strength to strength, and even today the majority of people who work for us are personally affected by the condition. I work full-time for ASUK and I have 2 children, one of whom is diagnosed with Alström Syndrome. ASUK work in partnership with Birmingham Children's Hospital and Queen Elizabeth Hospital to deliver the Alström service. We do understand how difficult life can be, but there is a wide range of support available. There is currently no cure for Alström Syndrome, but the clinics in Birmingham are helping to improve health outcomes for people diagnosed. We have some truly remarkable and inspirational families, and you are not alone.
Alström syndrome is an inherited condition, and it's inherited in a pattern that we call recessive inheritance. This essentially means that both parents have to have a misprinted copy of the Alström syndrome gene in order for them to have affected children. And if both parents have a faulty copy of the gene, then they're not affected themselves, but they have a 1 in 4 chance of having an affected child, but a 3 in 4 chance of not having an affected child, having a healthy child.
So we think that Alström syndrome affects perhaps 1 in 800,000 to 1 in a million youngsters, which makes it obviously very, very rare in the UK. I know of probably about 25 children with Alström syndrome altogether. If you're a parent and you're worried that your child might have Alström syndrome, the sorts of features that we hear about a lot are babies in the first 6 weeks of life who develop quite wobbly eyes. The medical term for that is called nystagmus. But the appearances of children who don't seem to focus on their mum's faces very well at all. There are lots of different causes of wobbly eyes, probably about 150 causes. One of those causes is Alström syndrome. So just because your child has wobbly eyes doesn't mean to say your child has Alström syndrome. It's just one possible cause of that. Other children can get liver problems, kidney problems older, diabetes a bit older as well, and then chest problems a bit later as part of that also. So it sort of affects every system in the body. It's quite a complex condition to look after, and it's quite a severe condition for children and adults. In about 20% of children are children born who get very, very bad heart disease in the first 6 to 8 weeks of life, very early on. And again, there are lots of different causes of bad heart disease that young. Alström is only one of them. And if you're unfortunate enough to have a child who has to go to hospital because of heart disease at that time, they probably don't have Alström, but it's just one of the possible causes of it.
We run one of the adult service in the UK. It's difficult to quantify how debilitating this condition is when even losing your eyesight is big enough by itself. When you also lose your hearing and become actually having dual sensory loss. In addition to that, also you would have trouble with your heart, and you will have trouble with your metabolism. Your body doesn't process sugar properly, becoming diabetic and having all the complications related to it. On top of that, all other organs such as kidney, liver and lung would be involved.
See you later. Yeah, see you later.
What we've tried to do with Alström Syndrome UK, Birmingham Children's Hospital, Torbay Hospital and the Queen Elizabeth Hospital is to set up special clinics with lots of different health professionals in to try and address all the different aspects of the condition. So in a hospital clinic like the one we have here, we have a genetics doctor to try and explain the genetics to the families, a children's doctor to look out for different complications that we can then treat. We can do hearing tests, a physiotherapist to try and help stretching exercises and make sure that the spine is straight and improve posture. a dietitian professional to try and advise on the healthiest diet to keep children healthy as much as possible, and also on exercise where we can as well. And then a number of other professionals, including a clinical psychologist, who really is there to try and help with children deal with emotional problems around having the diagnosis, and of course parents, so the worry that goes on with having a child affected also. So those are just some of the health professionals that we would include. We are increasingly involving eye doctors to try and chart the eye progression of the condition, and involving professionals with vision aids to try and help children, to help them get around. And most recently we've added a really nice lady, Marie McGee, transition care coordinator, who's helping young children think about making their own independent decisions about how to look after themselves, about progressing to adult care, and what sort of future they want for going to college, going to jobs and other things in their life.
A transition plan is a bit like a tool. It's a way of giving our young people a chance to tell us how they feel about things. So it's a range of what we call knowledge and skill areas that have been set into subheadings, things like mobility, vocational skills, school support, leisure activities, friendships. It covers a number of areas. Initially, we're looking for the young person, where possible, to fill out the document or have it read to them, or we can email it. We have a variety of ways, but I can have it brailled as well. So a young person can do their own mini assessment. However, there are another style of transition plan where I might talk to the young person and I might scribe it for them, or also the young people might draw pictures. And the plan gives us a chance to then work with the young person as an individual, take on the parents' views and put together a plan of action to support them for their future. Other aspects of the transition role as well are young people's voices. Their consultation is very important, and the reason it's important is because first of all we want to hear the young person's views, but we also want to use them to improve services now and for the future.
At the moment, unfortunately, there's not a cure for Alström syndrome, but there is a great deal of research going on in different centres around the country with the hope of treatments and cures in the future. But what we do know is that if the diagnosis is made early and better management put in place, then there's a better outcome for the children then.
There's research going on in the UK and there's research going on more broadly. In the UK, we've got a register for children with Alström and adults, asking people to donate or to give consent for their anonymised medical information to go into a big database so that we can try and link together people with different patterns of Alström to understand it better. And on a European level, we've got a register trying to link people throughout Europe. And the reason for this is we hope that there are going to be better treatments in the future. But to prove a treatment works, we have to do a clinical trial. And to do that, we probably need about 200 people affected with Alström syndrome. You have to give 100 the medicine and 100 a dummy medicine, follow them up over a year and see which ones actually are going to improve when you unblind it. But there's only about 50 or 60 people with Alström in the UK. So we need to extend this across the whole of Europe and probably the world to find enough people to understand the pattern better. Alongside that, there's really interesting research going on in Cambridge, taking little bits of skin that people have donated in the clinics and using them in the lab to grow stem cells. And we're using the stem cells as a model to understand the disease better. And we all hope in the future that the stem cells themselves can be used to develop new treatments for patients. It may take 5 or 10 years, but at least it's a resource, and scientists are getting really interested in this resource here in the UK to study the condition better. Then, of course, there's research in North America and research in Australia, particularly looking at mouse models of the disease. And I think we all hope that if we all work together and pool our resources, that we'll get to better treatments quicker for people with Alström syndrome.
A misdiagnosis is relatively common, and in fact, I don't remember seeing a patient who has not been misdiagnosed.
It's very hard because the condition is so rare and health professionals have to learn about so many different things. Lots of health professionals don't know what Alström is. And one of the big tasks is to try and make people more aware of this as a condition. This sort of work, I think, is going to help by advertising the condition to other health professionals, making them think about it when they see children who've got some of the symptoms of it.
The conference has been fantastic this year. It takes a lot of organising and we try and arrange a variety of different speakers. What is difficult is we try and meet the needs of all of our families. We run an Asian mentoring scheme and quite a number of Asian families now come to our conference, which is brilliant.
Parents feel is like, what do I do now? Where do I go? And they're there, you know, they're only phone call away. You ask them a question, they'll answer it. If they don't know it, they'll say, look, we'll get back to you. If it wasn't for them, I don't know where my youngest would have been now. And thanks to them, my kid's still here.
The Asian Mentoring Scheme is a scheme where we're trying to raise awareness within the Asian community, working with Asians, because obviously marrying a first cousin sometimes can be a bit of a difficult term to talk about.
So if we marry our first cousin or second cousin, then we always share some of our genes. So we're sharing our healthy genes, but we may also share some of our misprinted genes. So in that incidence, then there is a higher chance of having a child with Alström syndrome, but it's still very low. It's very small risk. But once you've had an affected child, there's a higher chance in a subsequent pregnancy. So Alström syndrome is a condition that affects all races and cultures.
The advice I'd give to Asian families is come forward. There's nothing to worry about. I can help. The whole of Alström team is there to help you, and don't be afraid, don't be scared. I'm a mum to an Alström child, so I can understand what your feelings are and what you're going through. We're not saying don't get married to your cousins. We're just saying there's genetic testing available.
At the moment, we can't predict who is at risk until there is an affected child in the family. But once one couple have had an affected child, then we should be in a position to offer carrier testing to everybody else in the family to see if they are also at risk of having affected children. For the couple who've already had an affected child, then there are other options available to them in future pregnancies. Some people choose to take another risk. Some people want prenatal diagnosis, but there's also the opportunity now in some instances of something called pre-implantation genetic diagnosis.
Look at the websites, look at the OrphanNet, Alstrom Syndrome UK, Birmingham Children's, Queen Elizabeth and EuroWAB websites, where we've got information about the condition. And if you are looking after a person with Alström syndrome, do let us know. It would be lovely to be involved with that person with you, maybe by just reviewing them once a year and perhaps being able to support you with the way that you look after the child, and putting other local health professionals in the community to support you in your care of the patient with Alström syndrome.
The purpose of this DVD is to demonstrate the support available to people diagnosed with Alström syndrome, their families and the professionals working with them. At the point of diagnosis, there is often a mixture of feelings experienced. One is often devastation when people learn more about the condition, but another is sometimes relief in that a diagnosis is finally given that explains the individual symptoms people have experienced. Every person and family are unique, and while there are many similarities in the experiences of our families, everyone will learn to live and cope with this condition in their own individual way. ASUK are here to support you every step of the way. For further information, please contact us on 01709 210 151 or email kerry.leeson@alstrom.org.uk or visit our website at www.alstrom.org.uk. Documents are available to download from this DVD onto your PC. Alstrom Syndrome UK would like to thank Genetic Disorders UK and Genes for Genes Day for funding the production of this DVD.